Hi there, my name is Tony Tiano, and I want to welcome you to today's Brain Matters webinar. It's about dementia caregiving and caregivers. And I'm really excited about all of our speakers today and this particular topic. I was a caregiver to my mom, and I wish that I had available to me in those days practical tips and strategies for self-care so that I could really be a better caregiver for my mom and also sort of hold my life together a little bit better. One thing that I learned along the way is the power of music, for instance. It actually accesses parts of the brain that activate speech, and it's a great way to reach through to people who have aphasia or other kinds of speech issues and problems remembering words. So they can sing better than they can talk sometimes. And my mom actually was in the hospital once, and I arrived there, and the staff told me that she seemed really strange. She was angry, and she was singing "Take Me Out to the Ball Game." And I said, "Oh, well, that makes perfect sense." And then they looked at me and I said, "What are the first three words of the song?" "Take me out." She didn't want to be there. So learning how to use some of these tools creatively and insightfully can be very helpful. And I also took up ukulele as a self-care strategy. So if your loved one loves music and you want to try music therapy in a way, then maybe give yourself the gift of a really inexpensive ukulele. You can join some ukulele clubs online and get free tutoring. And it can be a personal enrichment thing for yourself too. So music is miraculous. It helps everybody. While we're waiting to get this thing started a little bit more, I wanted to take time out to call attention to our partners in today's chat and in the year-round Brain Matters programming. We've been around together for a little more than a year, and it's a collaboration of different community-based nonprofits that are dedicated to sharing science-based information about brain health, health disparities, memory loss, and Alzheimer's disease and other related dementias. Among them are the Alzheimer's Association Greater Maryland Chapter. We have two Delta Sigma Theta alumni chapters involved, Annapolis and Columbia, Maryland. We have the Global Council on Brain Health, which is a project of the AARP. And we have the Johns Hopkins Alzheimer's Disease Research Center, as well as Johns Hopkins Resource Center on Minority Aging Research. Among the fabulous collaborators that we have would be Renee and Eileen and Corinne, David Parks, Veronica. We have a whole lot of people on our steering committee, and we really care about what matters to you. So please keep in touch with us and seek us out. We're all over social media, particularly on Twitter, where we've had several Twitter chats. And you can take a look at topics like overcoming social health disparities and looking at things like brain health in general by looking at our handle on Twitter and also following some of these Brain Matters hashtags. So let me here we go. So Brain Matters, we're going to have some audience polls today on dementia, caregiving, and caregivers. We're going to launch the polls now. We'll have two of them, and I will ring a bell when it's time. Sorry? We'll ring a bell when we're going to wrap it up in just a couple of seconds. So the first question is about your caregiving role. Are you an unpaid family caregiver? Are you a paid professional that goes into other people's homes and provides caregiving services? Or is this just not you at all? I'm going to wrap that up in about 10 seconds. Okay, get your answers in. Let's close that poll. All right, it looks like 39% of you are unpaid family caregivers. And then we have one person here who is a paid professional caregiver. But a lot of you, 58%, don't fall under those two categories. So I am curious about that. We do have a chat box and a Q&A box. If you would like to put in what your role is, if this didn't describe you, in the chat box, that would be really helpful to understand who's here today. And we'll use the Q&A the closer we get to actually having the Q&A sessions. So let's give us a moment to take a look at what's going on in the chat box and let us know who you are. We'll close this poll now and let's launch into the second question. And this is about your biggest caregiving challenge. You get to select just one, and I know there are many of them, but really think about what you want to take away today. So here's the question. What is the top challenge affecting you? Is it assisting with activities of daily living like feeding or bathing or diapering? Or are you having problems around changes in behavior? Is it wandering? Is it aggression? Is it coping with changes in memory and thinking abilities? Either you're coping with the changes or the person's at the beginning of a mild cognitive impairment and they know what's going to happen and they're having difficulties. And then there's also the financial impact of caregiving costs. Could be that you're working less, could be that you had to give up a job. And then there's always less time for self-care and your social activities. And sometimes that can make it feel somewhat burdensome. Then there's the stress and anxiety, the depression, less sleep shows up as symptomatic indicators for that. And then there are other things that you can describe. And if this doesn't apply to you at all, then you can just say that. So let's give this a few more seconds and I'll ring the bell and we can wrap this one up and find out what y'all are saying. Okay, let's wrap this one up. And the results are about 7% of you are having difficulties with daily living skills and taking care of the person. No one's having any issues with behavior problems and changes to that regard. A pretty big portion of you, 21%, have problems coping with the changes in memory and thinking. So maybe we can use the chat box to clarify that a little bit more. And you can tell us whether it's your emotional issues surrounding what's going on, or is it the person who's experiencing the changes that's having trouble coping. Maybe that'll help clarify the conversation a little bit more as we get into it. So then there's the financial impact, and that does affect someone. Less time for self-care. It's really important to fill that well with activities and having time for yourself. Otherwise, you won't be able to draw from it. So we're going to talk about that some today. And then the stress and anxiety. That's a decent figure. 14% of you recognize that. And that's after everything else that you've already prioritized. And then there's a few people who say something else, other. If you could please put in the chat box what those specific things are, that would be great. And if it doesn't apply to you and we missed a category, or you wanted to clarify what you're hoping to get out of this today, please use the chat box and put some information in there about it. So now we're going to close this poll altogether. And we're going to move on to the actual show flow here with our expert panelists. It's going to be a moderated discussion format. The structure is going to be that our experts are going to tell us a little bit about who they are and what they do in their professional work, and give us the three main takeaway points that they have to offer as a sort of jumping point into taking care of caregivers and also taking care of some key dementia caregiving topics. And then we'll have a moderated question and answer segment. The moderator will launch into this with a couple of questions that we've prepared to get it going. And then we'll use specifically the Q&A box for the audience participation. So if you could please remember to put your questions to the panelists in the Q&A box, that would be really helpful. And if you have other comments that you want to make during the chat, use the chat box for that. The panelists, they really are amazing people. I admire each and every one of these folks. We have Dr. Halima Amjad, Rita Choula, Dr. Chanee Fabius, Ilene Rosenthal, and Dr. Quincy Samus. So I wanted to say thank you to everyone who's a part of our panelists today and for your valuable insights. I know that you are extremely busy people, and taking time out to do this is really significant. So we recognize that and we thank you for it. Then I also wanted to take a moment to point out our moderator. I've known Jo Ann for decades. We go back a long time in the Annapolis community taking care of underserved populations. She's a member of the Annapolis Alumnae Chapter of Delta Sigma Theta Sorority, which has about 300,000 constituents nationwide. It's a primarily African-American sorority. Jo Ann is a nurse. MSN and RN are part of her credentials. And she is the co-chair of her chapter's Physical and Mental Health Committee, and she's actively involved in focusing on health and education services. She's currently employed as nursing faculty with Kaplan Test Prep, and she's the office manager for Dr. Lawrence Scipio. You may know that he has the same last name as she does. They're a real powerhouse couple, and he's great too. So I thank you very much, Jo Ann. I'll turn the show over to you.
Thank you, Tony, for that great introduction. We'd like to start with the first question. When do you know that you can no longer provide care for your loved one? And when do you know you need help? And I think I'll direct that to Ilene Rosenthal.
Thank you. I'm happy to address that. This is a really difficult question to answer, and it will depend on each caregiver's specific circumstances, how much support the caregiver has, and the caregiver's capacity to successfully manage that care. Caregiving, as you may know, can affect your finances, your health, other relationships, or it may just be too difficult emotionally or physically. Some of the signs that may signal the time to consider a residential placement could include things like when you can no longer control your loved one's wandering, nighttime restlessness that's keeping the entire family from getting a good night's sleep, behaviors, difficult, challenging behaviors that become unmanageable, incontinence, or just the strain of providing round-the-clock in-home care and threatening the family stability.
Thank you, Ilene. And I think I jumped the gun because I really should have introduced our panelists first. Our first one is Dr. Halima Amjad, and she's at Johns Hopkins School of Medicine. Halima, could you introduce yourself and your 3 takeaway points?
Hi, yes, thank you, Jo Ann. My name is Halima Amjad. I'm a geriatrician and clinician researcher at Johns Hopkins. I care for patients at the Memory Center here and conduct research on challenges in dementia diagnosis and care for people and families dealing with dementia. So I work with caregivers in all of these areas, but most of what I've learned about caregiving comes from my parents. My dad lived with young onset frontotemporal dementia for 13 years, and my mom cared for him at home with help. So from all of this work, I would say my 3 main takeaways for caregivers are to 1, educate and prepare yourself, take advantage of online and in-person information and trainings of healthcare professionals and of others who've walked the same road. Get a better sense of what to expect as dementia progresses and what challenges might come up. My second takeaway is that it takes a village and you really need support to run or even hobble the marathon that is dementia caregiving. Everyone's circumstances and what supports they can access are different. For my family, our village included immediate and extended family, some paid caregivers, both my mom and my dad's doctors, as well as online Facebook support groups that were specific to frontotemporal dementia. Every type of support, including emotional and moral support, helped my mom in her role. So bring in any support that you can. And lastly, just remember that everyone's life story, including the part about dementia and caregiving, is unique. You might not go through what others have gone through, and you may face issues that others haven't. And with dementia, there's a lot we can't control, but there are also parts of the story that we do, right? So just remember that there are moments of joy, love, and connection that we can find. There's also lots of room and really a need for creativity when you're giving care for someone with dementia. So when possible, focus on the positives, be creative, and make memories. I'll stop there.
Thank you, Dr. Amjad. Our next panelist is Rita Choula, and she's with the AARP Public Policy Institute.
Thank you so much. A pleasure to be here with my fellow panelists. I'm Rita Choula, the Director of Caregiving with the AARP Public Policy Institute. And I'll just start by saying I cared for my mother for over 15 years who lived with frontotemporal dementia. And so I'm very close to these issues. Professionally, I lead efforts within AARP to work with healthcare providers and social workers in both in hospital settings and community to really understand the role that family caregivers play and many of the stresses and strains that family caregivers like yourself experience to better help support them. I am also currently leading and working in a number of states to ensure that all older adults and their family caregivers across various races and ethnicities are able to access all of the services and supports that are in their communities. My three takeaways are you're not alone. I remember early in my journey as a primary caregiver that I felt so alone. And part of that was I didn't feel comfortable sharing our story and our experience. There are many people that are dealing with similar challenges that you face as a caregiver of someone with dementia, and talking about it and finding support in others can really be invaluable to you. Another is asking for help is not a sign of weakness. So often we think that asking for help means that we just aren't doing it, that something is wrong with us. But there really is strength in acknowledging that you don't have the answer for everything. You're not a doctor, a lawyer, a nurse, and all of the things that it really takes, that village that it takes, as Dr. Amjad said, to really be able to care for this individual. So without asking, it's really hard for people to know your needs and be able to support you. And then finally, I'll say the power of observation should not be underestimated. All too often, unfortunately, healthcare providers sometimes overlook what that caregiver is able to see and experience 24 hours a day versus the 15 minutes that someone is in office. So as the family caregiver, learning to take note of and share your observations, be insistent with those observations with providers, other family members, community members, etc. It's an important tool to getting the help you and the person you're caring for may need. Thank you.
Thank you, Rita. Thank you, Rita. Our next panelist is Dr. Chanee Fabius, and she's from the Johns Hopkins Bloomberg School of Public Health.
Good afternoon, everyone. Thank you for having me. And as my other two co-panelists have said, it's an honor to be here alongside those with expertise and experience in caring for people with dementia. My name is Dr. Chanee Fabius. I'm an assistant professor here at Hopkins in the Bloomberg School of Public Health. My work examines and understands and addresses disparities in long-term services and supports for older adults using long LTSS as well as their family caregivers. And I also do a lot of work around strengthening the direct care workforce, such as the home care workforce that provides services to vulnerable older adults, such as those with dementia. Should also say that prior to beginning my research career, I too had some caregiving experience with my grandfather who lived with dementia for many years, as well as being a care manager for the Connecticut Home Care Program for Elders, where I helped keep people at home and avoid nursing home placement, as well as helped folks transition out of a nursing home into the community and receive home and community-based services. So my three takeaway points are, number one, there are community resources that are available to caregivers that people are often unaware of, but that can provide services such as training and or respite. And for my family, in the case of my grandfather, it was Medicaid, home and community-based services. For others, this may be opportunities through area agencies on aging, so on and so forth. The second point is that these available resources may provide assistance to both caregivers and care recipients, echoing Rita's point that, you're not alone. Be it through support groups or respite services that you're able to receive, or training about what you might expect to see with dementia. But that these available resources can provide both care for your older loved one as well as yourself. And then the last point which is a very important one, is that, and what we don't often do, is that I encourage caregivers to have conversations, those tough conversations with older family members early, to understand the type of care they prefer to receive in the event that they require assistance with decision making. Do you want to live at home? Do you want to would you prefer to move to an assisted living facility? Would you mind moving in with us? Just so that when the time comes, if and when the time comes, you're making a decision that's been documented and discussed between the entire family. Again, thank you for having me.
Thank you, Dr. Fabius. And our next panelist is Ilene Rosenthal. She's with the Alzheimer's Association of Greater Maryland. And I had already given the first question to Ilene, so she can introduce herself, and I will repeat the question, and she doesn't have to repeat the answer.
Okay, well, thank you, Jo Ann, and thank you everybody for being here. It's a privilege for me to join this esteemed group of panelists. I am the program director for the Alzheimer's Association Greater Maryland Chapter, and my job is really to help families across the state who are affected by dementia to know about and access services that can help them in their caregiving journey. The worst thing I ever hear from someone is, "Oh, I didn't know you did these things. I could have used you when I was a caregiver." So we believe there are about 110,000 families affected by this, and we want very much for people to know they are not alone and to reach out and ask for help. So my 3 takeaways would be, 1, learn everything you can about the diagnosis, how it progresses, what challenges you may encounter, and how to deal with them. Sign up for caregiver education. We offer a number of nationally developed caregiver education programs that are provided in person, online, and also can be viewed on a website that are not live. But the online ones, also many of them are live webinars where you can ask questions. Make a note of the Alzheimer's Association helpline. That is available 24 hours a day, 365 days a year, every day of the week. It's 800-272-3900. Any question you have, someone there, a live expert, will be able to connect you with resources and help you identify what you need. We are a huge repository of information, and we can share with you lists of services, or we can answer your questions about your caregiving challenges. We can also provide care consultations and guidance on difficult situations. Another point I want to make is, and I think you've already heard this, consider legal and financial matters. Start discussions early with your loved one so that they can be involved and direct that decision-making process. And then finally, you've already heard this too, but ask for help when you need it. This could mean asking family members and friends to help you, or reaching out to local service agencies for additional care needs. And then make sure you build in breaks for yourself, learn how to relax, pursue hobbies, and take care of yourself.
Thank you, Ilene. Our final panelist is Dr. Quincy Samus from the Johns Hopkins School of Medicine.
Good to be with everyone. Thank you. Sorry, I jumped the gun, Jo Ann. Good to be with everybody. It's wonderful to be on this panel, and thank you to the organizers for putting us all together. I'm Quincy Samus, and I'm an associate professor in the School of Medicine in the Department of Psychiatry. And my primary job is basically, I'm a health services researcher. So I do research to understand what the needs are and to then develop and test evidence-based ways to address the needs and hopefully improve quality of care and improve services and supports that are available. And so some of the work that we do, for example, is testing models of care, like care coordination, for example, and other types of interventions. And what we aim to do is to test them in ways that they will then be reimbursable later, for example, through Medicare and things like that. And also to ensure that people are able to receive them equitably and to reduce healthcare disparities. As we know, some groups of people might be more vulnerable when they have dementia in certain areas and in under-resourced areas and things like that. And so My major points are just to tell you a little bit about what we have found in our research program in Maryland specifically in terms of understanding family caregiver needs. And so despite, a number of significant advancements that we've had in the state of Maryland with programs and services, caregivers still have some trouble accessing and knowing where to look for help, as well as kind of bridging medical services with supportive and informational services. And so what we found is that there's still a lot of unmet need, as you guys have already demonstrated through your poll. And so one of the things that really struck us is when we ask, so we have done a whole bunch of studies, and some of the things that have been some of the high prevalence needs are things like, understanding what is dementia and what to expect once a dementia diagnosis is given, kind of what to expect in the future, legal advice and advanced care planning, as has already been mentioned, and then behavior management. And the interesting thing is what we heard from caregivers is that's important, but their needs related to having time to attend to their own physical and health conditions, as well as the need for emotional support, as well as day-to-day support to kind of lessen the physical and emotional demands of caregiving, such as financial support and respite opportunities. These are the highest priorities that caregivers have told us. The second point that I would like to make is based on kind of, we've all just come out of, we're coming out of COVID, and COVID has had a number of impacts, both on people living with dementia as well as family caregivers. So we know from the evidence that's emerging now, people with dementia were more likely to acquire COVID-19, more likely to require hospitalization and have higher mortality. In addition to that, we also are seeing evidence of worsened cognitive impairment during the pandemic, increased impairment in function, as well as behavior. Now, caregivers also took a hard hit when it came to COVID, as well as the social isolation that came with that. We know that caregivers reported increased levels of stress during the pandemic, as well as need for breaks or respite, because as we know, services were either canceled or reduced during the pandemic's time. We also know that what we're learning is the whole kind of impact of social connectivity and the impact of social isolation and loneliness. And that really, COVID has really brought that to the forefront in terms of understanding how that impacts caregivers, as well as healthy brain aging, as well as cognitive impairment among people who have dementia. So that is one of the areas that we're it's kind of a silver lining for how we understand social connectivity. And that's an area that we're developing in terms of interventions to kind of support healthy aging, support caregivers, and support people with dementia going forward. Some of the positive aspects, of the pandemic included innovations in virtual connectivity, for example. So we are learning from a horrible event, and we hope to kind of use those learnings to leverage interventions in the future. And then the final point that I wanted to bring to the group today is that caregiver supports and enhanced services and better quality of care for caregivers is actually a goal for the new Maryland State Plan on ADRD that has just been released a few months ago, that myself, as well as Dr. Amjad, participated in developing for the state of Maryland. And so goal 3 is actually all about enhancing and expanding supports for family caregivers in Maryland. And there are, I think, over 20 different recommendations that we have made regarding how we can potentially enhance supports. These include things like assisting families in planning for care needs, promoting and expanding family caregiver supports across different types of settings, including home and community-based settings, assisted living settings, as well as nursing home and other settings. Also really focusing on addressing caregiver health and wellness, and opportunities to enhance the availability of and access to evidence-based programs that help with that. And then also to kind of better understand how COVID has impacted Maryland caregivers so that we can better plan for similar events that might be down the road. So I'll stop there. It's great to be here.
Thank you, Dr. Samus. You can see we have a panel of very well-prepared, very highly skilled professionals in this area. And we have practitioners as well as researchers. And at this point time, I'd like to go back to the original question, just if anybody has anything else to add to that. When do you know that you can no longer provide for your loved one on your own? When do you know you need help? So that's just kind of, when have you reached your peak and you need some help? Does anybody, Ilene did that. I think she did an excellent job in answering that. Does anybody have anything else to add? If not, we'll go to the next question. And I didn't see anything in the Q&A that related to that particular question. So I'll go to the next question.
I can chime in just really quick. I know with my grandfather, there were a few signs that led to the final decision to transition him out of the community. And he was a veteran, so he went to a VA long-term care facility eventually. But the first was that he did wander quite a bit. And he did that for a little while until he got lost for a long time. And he was gone all day and we didn't know where he was. So that was the first that was like the big thing. And then the second thing is that, he used to try to cook and he lived by himself. And it just became a point in which my father, who was his primary caregiver, just determined that it was no longer safe. So it really is going to vary for each person, as well as your capacity as a caregiver, and what you feel as though you can handle. The final straw, I guess you could say, or the straw that broke the camel's back, is that he pulled his old World War II revolver out on his caregiver. And while that did not work, the caregiver, obviously, for good reason, didn't want to go back in the house. And so we were at a point at which we kind of were forced into making a quick decision about his placement. But I would just say that, it really depends on the safety of the person, as well as what you're able to provide and your capacity as a caregiver.
Thank you, Dr. Now, while I was going to the next question, but there is one in the chat that kind of relates to that. And what do you do in the moment when someone opens the door and wanders? And since you had mentioned your grandfather wandering, Dr. Fabius, be able to answer that question for the audience.
Well, in our case, my grandfather had he lived in a senior apartment complex. So there were always women outside that were gardening and things that used to call my family and say, he's out, he's walking up the street again. But if you don't have that, and as a care manager, people often used alarms that they would put on the door so that you were at least aware that the person was trying to leave. Or they might move locks up to the top of the door so that the person could not get out if it was going to be dangerous for them to leave the house. And then just a lot of redirection in terms of if you're there and the person is trying to get out, my suggestion would just be, a lot of redirection to another activity that won't upset them won't upset them too much.
Thank you for that answer.
I was going to say, Jo Ann, if it's okay, I was going to just add to that issue of the wandering, because my dad definitely had a phase where his activity was going around the house and trying every single door. And if one opened, he was gone and moved faster than we'd ever seen him move. So we did use sort of multi-level strategies, like Dr. Fabius mentioned. We might redirect him. He liked going out for drives. So if somebody was available, we would take him out for a drive, or that's what we would have his paid caregivers do. We ultimately did have door alarms, put in more complex locks. So locks that had codes, or locks that you needed a key. So the house was almost a fortress. Even with that fortress though, right, doors sometimes get left open. So we had thought about and tried out tracking devices. He had an ID bracelet. I think a lot of our neighbors knew about his issues. And so we had a few times where a neighbor would come up. I think something we didn't do, but certainly we thought about it, and I've talked to patients and families about doing this too, is sometimes just giving some information to neighbors and even the local police about your loved one, so that in the case that someone else finds them, that they can help. So again, having multiple layers of defense around monitoring.
Thank you. That certainly gives a lot of information on what to do when you have a wanderer. Our next question, how do you convince your loved one that they need help with daily living? And we're talking about things like driving, balancing a checkbook, paying bills. How can we do that?
I think the short answer to that is you can't really convince someone who's living with dementia, and it's probably not worth your time and effort to try. That we know the brain disease is affecting their ability to reason and use logic. So I think this is really where kind of creative solutions and suggestions that you come up with or other caregivers come up with can be really helpful, right? Instead of asking someone if they want to do something, it's saying, let's do this, or let me help with, or do this for you. For driving specifically, you know, in our case, my mom simply started to do more of the driving. So you may just say that, oh, I'd like to drive, or, you know, I think you should have a chauffeur. If it's driving or safety issues, sometimes you have to pull in the doctor or someone else to sort of be the bad guy for you. And sometimes you just have to make things happen, like hiding the car keys.
Okay, thank you. Now we have anybody else want to add anything to that?
I agree. I agree. Go ahead, I'm sorry.
No, I said I like the idea that she said you can't convince them.
Correct, you can't. And I know in our case, and I always say, I don't know if it's the right strategy, but my father lied. And he said that the state took your license at a certain age because my grandfather really was not able to safely move around and drive in the community anymore. And he really liked driving. So the reaction was not good, but we also then had me driving around, you know, and dropping him off at his appointments and things like that. So we replaced the activity, you know what I mean, or we replaced the person who was, you know, completing the activity so that he was still able to get around. And that kind of worked as a negotiating point.
Thank you. Anyone else? Okay. Here's a question in the Q&A. Can you address the cost of respite care for caregivers? I went away and it cost $2,520 for my husband to be in a facility for 1 week. Anybody want to address? And there are a couple things on respite care.
I'll be happy to take a stab at that, Jo Ann.
Okay.
First of all, there is a limited state program administered by the Department of Human Services that does provide small respite grants to eligible families. If you were to call our Alzheimer's Association helpline, they also have a list of all of the respite resources in Maryland. Unfortunately, they just don't have enough. And everyone who has been a caregiver knows how important this is. So I just want to take a moment and say, if you want to get involved, you want to advocate, we feel strongly that the state needs to expand opportunities for families to use respite, because these are families whose goal is to keep their loved one at home for as long as possible. And when they're successful, it's better for everybody, for the family, for the individual, and for the state financially. And so if we can make the case that programs that provide respite need to be expanded, it will give many, many more families the resources they need to keep their loved one at home longer.
Thank you.
I would just like to add to that, excellent response, that respite, a lot of people don't even know what respite means, and it means different things to different people. Sometimes it really is having somebody come into the home while you go to run errands. It could be for a full day, it could be for an hour. Sometimes it means having somebody pay for something for you to have access, or some sort of diversion for the person that you're caring for. So it's important to really think about what is best for you in terms of respite and what you need to really help you do that self-care or reach for that self-care. The other thing that I would add is that if you are caring for a veteran, that there are services available through the Veterans Administration, and I can put a link in the chat to a phone number and a website where you can get more information on that as well. But totally agree with Ilene that it's woefully underfunded and there is a lot of need for additional supports.
Thank you, Rita. There's another question in the chat that relates to respite care, and that's what care is available for our loved ones. For example, the Alzheimer's Association provided us with 1 week each month for caring for their mother. They live in Arizona. So, but do we have anything here in Maryland that provides care like that, like 1 month, 1 week, a month?
Again, there are limited resources that are available. You can find out more by calling our helpline, or you can contact Maryland Access Point or your local Office on Aging or your local Department of Social Services. There are resources, but again, sometimes there are waiting lists and there's a desperate need for an expansion.
Okay, so takeaway there is that there are limited resources in Maryland, but you need to take advantage of what's available. Okay, also, what does one do in the, okay, we had that one. Can you tell us what innovation and Maryland State Plan is to bring to the residents that you're most excited about? So what innovation, what kind of things do we have available going on in Maryland that we can be innovated, invigorated, and know that something is being done? Because it seems like a really challenging disease. And if people know that there's something in the pipeline, maybe it won't happen while their loved one is available. But what's really going on? I guess our researchers can help us with that.
Yeah, so I'm happy to take that. So, so in terms of kind of the plan, that is a 4-year plan that was just published. That's 2022 through 2026. There are 5 goals. Goal 1 is to expand efforts to support public awareness of dementia and memory disorders, prevention and risk reduction efforts, as well as early detection and diagnosis. Goal 2 is really focused on enhancing the quality, service, and coordination for people living with dementia, so who have dementia and who have been, diagnosed. And then goal 3, as I mentioned, is kind of really focused on family caregivers. And so there are a number of recommendations and policies that relate to enhancing and expanding the supports related to family caregivers. And just an example, piggybacking on the conversation that was just having about respite care. So one of the recommendations that we have in the plan, and I'll put the plan in the chat so that you guys can all have access to the full document, which has a very detailed recommendations. But one of the items that is listed is the recommendation that the state of Maryland look at home and community-based services that are provided through Medicaid, so that as to potentially enhance different types of services, including things like adult daycare, respite, that could be respite services, as well as in-home respite. Because one of the things that could actually be done is people who are eligible for Medicaid and Medicare family members could potentially benefit from that respite, and it might actually save costs in the longer term by providing, time off basically for families to kind of get recharged. The 4th goal of the plan is really to advance ADRD innovations in research, as well as encourage the uptake of evidence-based practices into programs that are delivered in Maryland. So we kind of have, 2 parts to that. The first is kind of developing practical and innovative ways to address these problems. And then the second part is, once we know what works, like making sure that it actually gets to the people. And so there are a number of recommendations and strategies to try and enhance that. And then the 5th goal is really just to enhance the way that we can track the needs of Marylanders, as well as what is the impact of all of our programs and services on people's outcomes, like what matters to them, as well as healthcare costs and other types of quality metrics. And so the plan is very comprehensive, and it really kind of pulls from, we did a very comprehensive review of I think 18 different states who had recently updated their own plans to kind of get as many elements to try and build the infrastructure for Maryland to be successful in addressing this huge need, in the short term and then over the longer term period.
Thank you.
And I'll put that in the chat.
Okay. Thank you. That would be very helpful. Anybody want to add anything to that? Okay, here's one in the chat. I'm a single woman caring for a parent in my home. I will likely need to go from full-time work to half-time to be more helpful as the decline continues. Are there financial support options for people decreasing salary to care for family?
So I would say immediately contact your local Office on Aging and have them do an assessment of your loved one and help you put together a care plan. There are programs, again, sometimes you encounter waiting lists. The best one is the Medicaid Home and Community-Based Services Waiver, which is designed to defer people from having to go into a long-term care placement by providing services in-home. But it's really important to get your name and your application in sooner rather than later. And then explore other potential resources. They have support planners that can help you identify what other local publicly funded resources may be available and help you begin putting together a plan.
Thank you.
And I'd also like to add, in putting together that plan, I think it's very important to think about what it is that is making you feel you have to go from full-time to part-time. Because if there are other resources or avenues for help based on what those needs are that can prevent you from having to go down to part-time, I think it's very important as family caregivers that the challenge can often be that we're dealing with the now, but we don't think necessarily long-term about our own selves and our own financial security. And so whatever we may be able to do to extend our time to be able to bring in that full-time employment, I think is very important as well as you think about the whole plan.
Okay, thank you. Next question here is, caring for someone with dementia is a very challenging job. What suggestions do you have for caregivers to manage their own stress? So how do caregivers deal with the stress that they're going through? So tackle that.
So I'll be happy to answer that one. Some caregivers have a very difficult time accepting help. They mistakenly believe that they should do everything themselves. And this attitude is harmful, and not only to the caregiver, but to the person who has dementia. So caregiver stress can lead to irritability and anger, exhaustion, depression, and many other problems. So I would answer that by saying, know what community resources are available, get help and support, consider joining a support group. Also use relaxation techniques, find time for yourself, and as I mentioned before, become an educated caregiver, because as the disease progresses, new caregiving skills may be needed.
I would also say that I can put it in the chat, the National Family Caregiver Support Program, Maryland has one. And so that would provide services that are specific to the caregiver. So in addition to some of the respite that we've talked about, the program also provides information, assistance with accessing services, counseling, education, the establishment of support groups, speaking to the point that you're not alone, and some other supplemental services. So it might be worth it to take a look and see if there are, because much of the challenges, services, wherever you receive them from, the target person is the person with dementia. And so you often don't have caregivers being assessed for their needs. And so if you're interested in learning more, I can drop that website in the chat.
I was just going to also add, I know everybody, right, like caregivers always laugh, right, if someone talks about self-care and doing yoga and exercise, right, you're like, who has time for that? So I would second, I think Ilene mentioned support groups, and keeping in mind that that's where the virtual world is helpful, that, right, even going to a support group, who's going to take care of your loved one? So I know we used a lot of online support groups. Certainly now there's a lot of Zoom and telephonic support groups as well. And I think the other big piece is just remember, you don't have to be a perfect caregiver all the time, right? So I know some of my Alzheimer's caregivers feel like, well, I have to keep the person stimulated all the time and keep them busy. Well, maybe sometimes it's okay for them to sit and watch TV if that gives you time to do something else. And so giving yourself grace, I think, is an important piece of dealing with the stress of caregiving.
Okay, thank you. We have another question. As many caregivers find it difficult to communicate with healthcare providers about the challenges they face when caring with someone with dementia. What are some tools for the caregiver and the provider to help make this discussion more fruitful? So caregiver and provider communicating effectively with each other for the benefit of the patient.
I can jump in on that one. I think, oftentimes as a caregiver, we defer to the healthcare provider as the expert, and they truly are the expert. What we don't often do, or we don't feel comfortable doing, is really sharing what we're seeing at home, what we're experiencing, not only as the caregiver, but in our care, the observations, as I mentioned earlier, that we're making or that we're seeing with the person we're caring for. In my instance, it really was a misdiagnosis. While my mother ended up being diagnosed with FTD, it was after a very long struggle, shall I say, that even though I provided observations to the provider, she was diagnosed with Alzheimer's. And so I spent a lot of time and stress and anxiety trying to care for someone with behaviors very different than what they were diagnosed with. And so I really, really learned how to be as expressive as possible, and to really communicate, to really ask questions. No question is too much of a question. And if a provider gives you as that caregiver a task or a responsibility and you don't feel safe doing it, or you have issues, concerns, additional questions, to always feel free to keep that line of communication open.
I think I'll add, I know for our caregivers, a lot of times, right, over time, the caregiver becomes the main point of contact. So making sure your phone number is in the medical record, I think, especially early on, if the person's going to appointments alone, just being able to be present at appointments. I know we're always happy to pull people in on the phone, but I know some people may be unfortunately resistant to that. So when you can be there in person is helpful. And then I think building on Rita's comment about communicating, think about other ways you can communicate. Sometimes it's just leaving a telephone message to the doctor. They don't have to call you back, but you want them to know about these observations, or getting the electronic health record access. So we certainly get a lot of MyChart messages, sometimes in advance of an appointment, because the caregiver doesn't want to bring up these issues in front of their loved one, or that there's just so much to bring up and they know it's a limited time. So sometimes having that information beforehand can be helpful. And then I think just trying to set yourself up as a partner, because I think the other thing I always advise people to keep in mind is that healthcare professionals are human too. So if you're extremely upset and it comes across as upset at them, they unfortunately might react. So I think in that sense, just being honest and vulnerable, right? Because oftentimes if a caregiver is upset, it's because it's hard, it's because of what they're dealing with, it's difficult. And I think in that sense, being honest and vulnerable will, I think, make the partnership more fruitful.
Okay, thank you. Do we have any more questions in the chat or Q&A? I'm not seeing anything else.
And just to say, all of the great information, like a lot of the great information that's being given is available in very nice kind of educational documents online at the Alzheimer's Association, as well as, so if you search advocate for people with dementia, for example, you might pick it up from the Alzheimer's Association, also NIH and NIA, which is the National Institute on Aging and the National Institutes of Health. They have really great educational resources on healthy brain aging and dementia for caregivers, as well as CDC and the National Caregiving Alliance, as Dr. Fabius talked about. So there are some great trusted sources of information at those organizations that's available for everybody.
Okay. What about people getting into clinical trials for new interventions or medication treatments? How can they go about doing that? And particularly in the African American community, where our numbers of participants in research and trials is down. Overall, we want to get people involved in clinical research so that everybody can benefit from it.
So there's two really great resources online. One is hosted by the federal government, and so that is called clinicaltrial.gov, right, Halima? Like, I think that, and then the other one is hosted by the Alzheimer's Association, and that is trialmatch.com, I think. Is that right? But basically, you can search online to see what it's actually a requirement, a federal requirement for all NIH-funded studies that they be listed on both of those websites, and we can put them in the chat. And then you can also, contact us as panelists, at least myself, if you're interested in research related to Alzheimer's disease and dementia, like happy to provide you information for the trials that we are currently running at Hopkins, including one that's all about kind of activity-based companion, virtual companionship for people living at home with dementia called Memory Core. But that's just an example.
Okay, thank you. And what about ideas about any studies that might be done that are not already being done? Anybody have any ideas about that? Okay. Looks like we've answered all the questions. And attendees, do you have any other questions that you'd like for us to answer before we wrap up? I don't see anything else. I will turn it back over to Tony.
Well, first and foremost, I wanted to thank everyone who is here today and taking part of the very engaging and important conversation. I put in the chat box the full list of participants and who they are. You can check us out on the websites and contact us there. Many of our organizations have newsletters that you can sign up for and become involved in, as well as a Facebook presence. So I encourage you to continue engaging with us. And please feel free to contact me if you have any ideas for possible future chats or webinars. This is our first webinar, and I think it's been pretty successful, but it would be great to know if you have other ideas in the future of topics that would be helpful to you, because the community is what we're about. We want to meet your needs and give you information you need to know. So thank you again to all of our fabulous collaborators and panelists and organizations. And yeah, I just admire everything that you're doing. This has been a wonderful hour, and I will treasure this opportunity and keep these points in mind moving forward. Thanks again, everyone, for being here. Stay safe and be well.